I'm Joanna Cohn. I'm the director of the Institute for Global Tobacco Control here at the School of Public Health. And welcome to our Innovations in Tobacco Control lecture series. We have one about every month, and we have 2 more coming up for the rest of the year, so really excited about that. But today it's my pleasure to introduce Dr. Suchitra Krishnan-Sarin. She's a professor at Yale University in the Department of Psychiatry at the Yale University School of Medicine. And her focus and interest is in biobehavioral factors that influence substance abuse behaviors. She's focused a lot on tobacco, but not just tobacco, has done work in marijuana. I saw a lot of gambling papers that you published, which I didn't realize, so a whole range of addictions, I guess. And she's also used a lot of different approaches to her research. So she's done clinical trials, qualitative research, experimental studies, so a whole range of work. And she's really interested, all this sort of feeds into trying to develop effective prevention and cessation programs. She is the co-PI on the Yale T-Course, which is a FDA-supported tobacco center of regulatory science. And her T-Core focuses on the role of flavors in tobacco and nicotine addiction. So she'll be sharing some of her work today on electronic cigarettes. So welcome, Suchitra. Thank you for coming.
Thank you, Joanna, for the invitation and for, I've had a great time speaking with everyone over the past 2 days. Had some great conversations with folks on areas which I know very little about. So it's been as much of a learning experience for me as it probably has for, hopefully, for some of them that I've spoken with. So I'm going to tell you about e-cigarettes today and our work in the e-cigarette area. But Joanna's right, my interests are very wide. I am what you would call a true translational scientist, as I like to say, because I actually started out as a pharmacologist and toxicologist and then retrained in clinical psychology and then epidemiology. So if anybody ever tells you you can't change paths in your career, they are wrong. You can. You just have to be fortunate enough to be able to do it when it works for you. And I think luck played a big role in my transition in each of these stages. But anyway, so I co-lead the Yale Tobacco Center on Regulatory Science, which was funded by FDA. There are 13 such centers in the US, and ours is one of them. And I'm going to tell you a little bit about our work on e-cigarettes through the center. So for those of you who are not that familiar, by the way, I have a whole set of slides, and I have data I'm going to show you. But I would like it to be as interactive as possible. So if you have questions that you have along the ways, please feel free to interrupt me. I'm happy to discuss any point and or show you additional data as it comes up. So this is an electronic cigarette. I'm not sure how many of you are familiar with it, so I thought I'd give you a little bit of an introduction to this topic. Essentially, it is a vaporizing device. It's been around for vaporizing a wide variety of products. It's been used in marijuana, actually, for a very long period of time, also in the marijuana field. An electronic cigarette was originally created as a clean form of administering nicotine. And essentially, what it contains is a battery that heats the sorry, what did I do? Okay. A battery right here that heats, that provides power to the device. This particular model is made up to look like an actual cigarette, so the tip lights up and you feel like you're smoking an actual cigarette. There is an atomizer or a heating device in the center. And then there is an area which contains a liquid nicotine cartridge, which contains whatever solution you're administering to yourself through using this device. For those of you who are not aware, the presence of these devices in itself has created a huge public health divide, not just in the US, but also worldwide. And what I'd like to first do is to give you a little presentation of what the arguments are and what all this debate is about, and then I'll show you some of my own data from youth. So the problem is, as I said, these devices were created as a clean form of nicotine to help smokers. tobacco use or cigarette smoking, as you know, is one of the biggest public health problems even today, and one of the biggest reasons for a lot of deaths and diseases that you see in the US and globally. This is some data from the US and a little bit worldwide also in terms of how many smokers are there. And I put this slide up there just to give you an idea of what the impact of the problem is or what the extent of the problem is. So these numbers in itself will convey to you that the impact of this cigarette smoking is huge. Life expectancy for smokers is at least 10 years shorter than non-smokers. So keeping this in mind, the idea that there might be a product which could help a lot of these smokers quit smoking is extremely attractive in the tobacco control field. I put this up there because I think this came out from when the Surgeon General report came, Surgeon General's most recent 50th anniversary report came out. This talks about the adult per capita cigarette consumption. And you can see this huge increase in per capita cigarette consumption around and after the Great Depression. And I'm always fascinated when people present this slide side by side with the increase in lung cancer rates, and you see how they parallel each other. This increase really parallels the increase that we saw in lung cancer rates in this country, and that it's really fascinating to see that association. But then we put a lot of things into place in the US, like the multiple Surgeon General's reports. We had a master settlement agreement with the tobacco companies. There were a lot of federal cigarette tax things that were put into place. And then we had the actual ability of the FDA now to regulate tobacco products. So all these public policy kind of things which have been done over the past few years have really done a good job of reducing the tobacco use rates. You can see here that the per capita cigarette consumption is much lower today than it was in the 60s or 70s when it was at its peak. However, the problem is we are not completely done yet. There are still a lot of smokers who are very addicted to cigarettes, who do not find it easy to quit smoking, and you still see the disease and death toll related to cigarette smoking in these populations. And some of them include people with mental health disorders, people with other diseases, people with cancers, adolescents. So the wide range of subgroups who are still smoking cigarettes and are still being exposed to all the toxic effects of cigarettes. So there is a lot of interest in trying to come up, as I said, with a cleaner form of nicotine use, which could be used to eliminate the use of cigarettes or combustible tobacco products, including cigars and cigarettes and all the other combustible tobacco products. And if this clean form of nicotine could be used to rapidly eliminate the use of this combustible tobacco products, the thought is that we will dramatically reduce the burden that these products have posed on the public. And in the 2014 Surgeon General report, there was also a statement which said that promotion of e-cigarettes and other innovative products is likely to be beneficial where the appeal, accessibility, and use of cigarettes are rapidly reduced. So they actually made a statement saying that the use of e-cigarettes might be beneficial. However, this is where the debate comes in. The problem is, in the US, e-cigarettes are not regulated as a drug delivery device, and we had a huge conversation about this yesterday, and I'm happy to tell you more about it if you don't know about this, but this was a lawsuit that we lost in 2009. So in the US, the e-cigarettes can only be regulated as a tobacco product, not as a drug delivery device. So in other words, it can be used to substitute for cigarettes by cigarette smokers in a market where cigarettes, cigars, e-cigarettes are freely available, but it cannot be sold as a quit smoking device. So this is a very important issue to keep in mind when you're thinking about e-cigarettes. These are some pictures, and you can find tons of these if you go on YouTube, of all the different kinds of e-cigarettes which exist. We now have multiple generations. The first generation was a very rudimentary product which varied widely in terms of how much nicotine it actually delivered. So if you smoked it or you used it, you would get, not smoke, they use the word vape, But if you used it, you would get a huge dose of nicotine initially, but after that, there would be no nicotine in the solution because it wasn't distributed very well. Then they got better at creating the second and third generation devices, and now there is a fourth generation device, from what I hear, which is supposed to be even better at delivering the nicotine deeper into your lungs for better absorption. So, but the market is just booming, and these are just some pictures of all the different kind of products you get to find. The most popular products today are these mods, if you've ever heard of them. They are tank systems, which basically contain a tank, and or you can modify it in any different ways, many different ways that you want. You put the solution in it and you vape it. So that's there's all kinds of devices out there. Of course.
So are all e-cigarettes using this liquid nicotine, or are some using the loose tobacco material?
So, okay, there's multiple answers to that question. No, all cigarettes are not using the liquid nicotine, so just the liquid nicotine in the tank. There are e-cigarettes there are mainly two forms of e-cigarettes that are available. One is an open tank where you can put whatever you want into it. So you can put a solution in, you can pack it with whatever leaves you want, you can manipulate it that way. Then there are cartridges that you can actually buy, which are cartridges that fit into your e-cigarette system. And the cartridges are pre-saturated with some solutions. It could be just a flavor, it could be nicotine, it could be a variety of solutions. And then you get a third kind, which is actually the most popular amongst adult smokers, called what we call cigalikes, which look exactly like a cigarette. It contains a cartridge inside, but it's completely enclosed, so you cannot play with it. You can't manipulate it in any way. It looks exactly like a cigarette. So blue e-cigarette is an example of that. Not the current version of blue, which is a tank system, but the first version of blue that came out that you saw in Walgreens on the back walls, the black e-cigarette with blue written on it in blue. That was a cigar-like product, or is still a cigar-like product. It contains enough of nicotine in it for one full pack of cigarettes. So the idea is you can take a drag from it whenever you want, and then shut it off and put it away, and then recharge it. So the way the figure I showed you earlier, when you puff on it, it essentially activates the whole mechanism in there and allows the vapor to be created. So, sorry, long answer to a short question. Okay, so there's a variety of different products. This is where I want to show you the impact of the problem. These are e-cigarette sales in millions of dollars. They had the projected sales by Wells Fargo back in 2012 for 2014 was 1.7 billion. We far exceeded that in 2014. You see the numbers down there. It's much more than what they predicted it would sell at. So this market is just exploding, and it's really growing exponentially. And the problem is, as far as regulations are concerned, FDA does not regulate these products as yet. There is a deeming rule out where they have said they plan to start regulating the product, but there's no regulations in place yet, and we don't know what the deeming rule will really have in it, how they plan to regulate the current existing products that already exist on the market. But there are no product standards. There's no minimum maximum for nicotine or other constituents. There's thousands of flavors. In fact, I'll show you some data. There's over 7,000 flavors of that are available. You get anything and everything you want. And this is very attractive to kids, as you can imagine. There are some indoor air regulations. They are not consistently applied across the board, but some states do have indoor air regulations where they say they classify it as a tobacco product and therefore say that you cannot use it indoors, but not all states do that. There are no warning labels, no advertising restrictions, and no across-the-board restrictions for sales to minors. So the reason I'm pointing these out is these are all the methods that worked in that graph I showed you, where we actually have managed to reduce cigarette consumption over the past 10, 20 years. These are some of the policy things that worked: indoor air regulations, advertising restrictions, warning labels. These are all the things that actually worked in reducing, I think, some of the cigarette use that we have, enormous increase in cigarette use that we saw after the Great Depression. So the problem with e-cigarettes is there's insufficient evidence on safety and efficacy. And I would like to start this talk by saying is I'm going to show you a lot of data that's problematic in youth, but I still really walk the fine line in terms of whether I believe this will help or not. And I'm waiting for some of this safety and efficacy evidence to come in to really make a decision about whether this is going to be useful for adults. And there is a very good possibility it might be a cleaner nicotine form for adults, but we just don't know yet. And any stipulations that suggest that this is safer and more efficacious, or safer, I should say, than cigarettes, just know there is very limited scientific evidence on this issue at this point. These are some e-cigarette components. And this also brings up a reason for why we are concerned about this product. So we know it doesn't contain the 4,000 other chemicals that we have always been told that cigarettes contain. However, the aerosol vehicle that actually produces, that's in most e-cigarettes, contains propylene glycol and vegetable glycerine, which, for the most part, for those of you who are environmental chemists, are considered to be generally recognized as safe. But that classification of GRAS was really for environmental purposes and not for the purposes of use like you're seeing in e-cigarettes, which is the chronic inhalation of this product into your lungs. And this is where the concern comes in, because we don't want to be endorsing something that is not safe. And we have very limited information on whether the use of these products and these constituents is really safe when it's chronically inhaled. Some additional concerns are there is some evidence, and we need more evidence on this, that at high temperatures, these constituents can form compounds like acrolein and formaldehyde, which can induce cancer, which have cardiovascular concerns. There's a variety of concerns associated with these compounds. The e-cigarette also contains nicotine, and this is where my work is really focusing. There's a great deal of concern that the nicotine in these e-cigarettes, if youth are exposed to it, it could produce nicotine addiction. And that's one of the concerns. And nicotine during the developmental stages has been shown to have significant toxicity on the developing brain. So there's a lot of concern about the nicotine in these products. And then I talked to you about the flavorings. I mean, there is a number of flavorings in these products, and many of these flavorings contain chemicals like cinnamaldehyde, benzaldehyde. There have been some presentations with diacetyl, which for those of you who have worked in the tobacco field for a long will remember the story of popcorn lungs. Popcorn lungs was a phenomenon which was identified by people who were working in popcorn factories where they were using butter flavorings. And the diacetyl is a compound which is in the flavoring, and people are actually being exposed to that had these lungs, and they had all the chronic lung problems associated with it, and it was identified as a term called popcorn lungs. So this is in many of the flavorings, so we don't know what's going to happen with the chronic inhalation. And there are some other cigarette components too. Again, the other contaminant issue varies a lot from e-cigarette to e-cigarette. We don't really have a good way of evaluating which one contains more or less of each of the products. Without a doubt, the emerging literature seems to suggest that the levels of many chemicals which are traditionally seen in cigarettes are 9 to 450 times lower. That's a rather broad range, so I have to ask Maciej at some point where he came up with that number. But his evidence very clearly shows that the levels of many chemicals that are normally found in cigarettes are lower in e-cigarettes. But as I said, there are other components, and there are a lot of unknown acute long-term effects. As far as electronic cigarettes and smoking cessation, there are a lot of anecdotes, a lot of testimonials if you go on the web, online. People saying this thing saved my life, I quit smoking because of this product. But there are very few clinical trials. There is nobody who has really examined this and produced any empirical evidence-based data showing that these products either help people quit or that the presence of these products in the market makes people switch to using this product and not using cigarette, which would also be an acceptable outcome. If you could show that smokers are switching completely to using e-cigarettes, granted, we don't know about their harm yet, but still, considering that they don't have all the chemicals that cigarettes have, if they switch to using this product, then maybe it would be safer than smoking cigarettes in a one-to-one comparison. But there's very limited evidence on this, and there was a Cochrane review which was based on all of 3 studies, I think, which essentially showed some potential efficacy, but if you look at it, the odds ratios were very, very small. It wasn't really that convincing to me. They actually compared, one of the papers compared e-cigarettes to nicotine replacement and showed there was no difference. So that e-cigarettes were equally effective as nicotine replacement therapy in producing, in quit rates. So again, it raises the concern of what should your standard be and what should be the bar for evaluating these products, which is all work that's ongoing in the face of this enormous exponential rise in e-cigarettes. So this slide essentially lays out the potential problem for you and from a potential harm and public health benefit. So I thought it was important to show these slides first, and I thank John Samet for giving this to me, because there have been a lot of people who have been putting a lot of thought into understanding this. So for youth, everybody agrees it's not a good idea for youth to use e-cigarettes, period, or initiate e-cigarettes. So I don't think there's anybody who disagrees with that point. For youth, there's increased exposure to nicotine, the possibility of greater nicotine addiction and greater initiation of conventional tobacco products. And there is a concern that all this effort we've put into reducing youth use behaviors may go away. Like there might be this whole renormalization of tobacco use behaviors, that youth might now think it's okay to use these products. For adults, the concerns are about maintenance of smoking behaviors and slowing of cessation. So will the availability of these products lead a lot of adult smokers to just maintain their smoking behaviors and not necessarily quit? Our advice so far in the field has always been, if you're a smoker, you should quit. And now we are going to give them a different message. And what effect is that going to have in adults? Will it just lead to maintenance of smoking behaviors? Will it lead to them quitting completely? We don't really know. Quitting cigarettes completely, we don't know the answers to this question. And then, of course, there's the whole secondhand aerosol exposure piece, which I won't get into today. However, if we show this is effective in getting people either to switch from smoking to this product, or reduce their cigarette use behavior, there are definitely benefits you can think of on a global public health perspective, which would be reduced disease risk for current smokers who switch to e-cigarettes, to reduce or quit using cigarettes or other combustible products, and also reduce disease morbidity. So this is what the whole public health debate is about. You know, which way should you really lean, and what evidence is there to support each one of these? So let me now move into some of our data on youth and tell you a little bit about the data that we've collected. So as I said, there's a great deal of concern that presence of e-cigarettes could lead to initiation of tobacco use amongst youth. And I have to say, we still don't have the evidence to support that statement. This is all a matter of collecting, unfortunately. This is not something you can collect overnight. It takes a while to collect sufficient longitudinal data to really prove this theory. But to reiterate again, why are we concerned about e-cigarette use amongst youth? It's because most tobacco use is initiated during adolescence, and smokers who initiated during adolescence have been shown to be more addicted, find it harder to quit smoking, and smoke for a longer period of time. So obviously, that's why my work is really focused on prevention and cessation programs, with the idea that if you can get kids to quit before it becomes a chronic habit, then you may have won the battle to preventing them from having all these disease risks. In order to address the e-cigarette issue, we've been conducting a series of studies, and this is like a compilation of everything we've done so far. We conducted a series of focus groups with high school, middle school, and college-age smokers and non-smokers to look at perceptions and attitudes towards a variety of tobacco products, including e-cigarettes, hookah, cigarettes, and we looked at that data to see what they said about e-cigarettes. And based on that data, we actually designed our surveys. So we've completed 3 waves of surveys, and let me tell you, every wave, we collect the data and we say, why didn't we ask about that? And so the next wave has more questions, so it never gets smaller. So this is actually a problem, because there's always more questions than answers, unfortunately, when you do this kind of work. So we've done 3 waves, and I'm at this point in the very frustrated mode with this phase, because we have 10,000 kids who completed this survey, and we are in a data cleaning nightmare mode. So I so badly want to get my hands on the data, but it's not there yet, and we are still cleaning it. So I've decided that next time around, I'm going to come up with a better way of doing these surveys, probably using like an iPad or some kind of electronic system where you can have skip outs. If there's anything you want to learn from this, this is something to learn, which is a paper and pencil survey is actually great when you're going into a school and surveying thousands of kids at the same time, but it also creates logistical nightmares afterwards, which I don't know. it's, you have to weigh the benefits and risks of that, I guess. But anyway, we've done 3 waves, so I'll show you some data from our wave 1 and our wave 2. And essentially, when we do these surveys, we try to recruit schools from different district reference groups in Connecticut. In Connecticut, schools are classified according to socioeconomic needs into district reference groups. So we try to sample from as many different district reference groups as possible. The way we do this is we send out letters to dozens of schools saying, will you please participate? We are doing this. And of the ones that respond, we kind of randomly pick schools to participate because we are also limited in our resources that we have. So I'll walk you through a series of questions that will be answered on these slides. And some of you may have seen these slides before, so I apologize, but I have some new ones, I promise. So this is the data from the fall 2013 survey about e-cigarettes knowledge and use rates amongst high school students. And the questions basically ask them, have you ever heard of e-cigarettes? And you can see, even in 2013, almost everybody knew about e-cigarettes. And these are rates of use of e-cigarettes. Now, there is an ongoing effort by the tobacco centers to come up with better ways of asking these questions, because we all agree that just focusing on past 30 days or asking, have you ever tried e-cigarettes, is not the best way to get at this problem. But when we started, these are the data that we had, and these are the questions that we used. But even here, you can see that rates of ever trying are really high amongst those who were past 30-day smokers, and continue to be high when you ask about, so past 30-day use of e-cigarettes are those kids who say they have used e-cigarettes on a more regular basis in the past 30 days, so are going beyond just using it once in the past 30 days. So that's how we classified those kids here. So among smokers, again, for past 30-day use, a significant percentage of them report they used e-cigarettes more regularly. And you're also starting to see an emergence of use amongst those who say they are never cigarette smokers. So I've never touched a cigarette in my life or a combustible product in my life. And you're starting to see increase in use amongst them also, in both ever trying and past 30-day. But what concerns me are these ever cigarette smokers. And we are trying to understand them better in our current survey. The way this group was defined is these were people who had, let me just finish this definition. These were kids who had tried cigarettes in the past, but said, I didn't continue because I didn't like it. So this concerns me a little bit because you're starting to see increased use of e-cigarettes amongst these kids, which makes sense because these are probably the kids who would have tried these products anyway, but they tried cigarettes and they didn't like it. But they are trying e-cigarettes now. Sorry, Ryan, you had a question.
What are the state regulations around youth purchase?
At this point, there were no regulations. In 2013. The state regulations went into place in 2015, just the beginning of this year, both for minor access, sales to minor, and also tobacco-free laws just went into effect.
And is it 18 now you have to be?
Yes, yes. But at this point, there were no restrictions. Yeah.
Okay, so when a new smoker smokes a cigarette, it's harsh.
Yes, yes.
Can you just give a brief description of what the comparison is? So if I'm 14, I smoke a cigarette, hurt my throat, I hated it, but then I tried blue.
Mm-hmm.
What is that?
Well, you wouldn't start out with blue because I don't think too many kids start. Well, some kids start out with blue. I'm going to show you. I'm saying disagreeing with my own data that I'm going to show you in a second. But the initial kids say that the e-cigarette is very easy to use. They don't. Even initially, because they don't get you don't get the same throat hit from e-cigarettes that you do from cigarettes, which is, throat hit is something that any cigarette smoker, if there are any in the room, will tell you exactly what that's about. It's that burning sensation in the back of the throat. Many people who become addicted to cigarettes, that's what they smoke cigarettes for. They like that effect, that burning, kind of harsh effect in the back of your throat is something they really like. You do not get the same thing from e-cigarettes. It's actually a very palatable, I tried it. It's a very but I tried cigarettes too and I didn't like them, so I guess I can admit to that. But it's very palatable. You really, there are certain flavors that people don't like. So for example, if you're just starting out, you should probably not start with a tobacco flavor because it's really gross. But if you start out with like a vanilla cream pie or a strawberry or something, it's actually very, very pleasing. And on the side note, I have to tell you, another unintended consequence of the presence of these products in the market is it's being used in populations with eating disorders. So people are using it to suppress appetite. They are using it for a lot of other purposes. We don't know if you're using it with or without nicotine, but this is all anecdotal data, and we are trying to collect more data on this. But if you go on any of these eating websites, like online websites, you'll see discussions about the use of e-cigarettes and how it's helped them. So, exactly, yeah, it really helps. It's found a different use too, which is very interesting. But does that answer your question? It's actually very pleasing. Yeah. So as I told you, we did middle school versus high school. So I'm just showing you some middle school data just to drive home the point that middle school kids are not, so it's not like it's just the high school kids. Kids seem to know about it. There are increasing rates of ever trying and past 30-day use amongst middle school kids. The rates are still really small. But if e-cigarette use, for middle schools, it's around 12 years, which is lower than what it is for cigarettes, actually. And for high schools, age of onset of e-cigarettes is around 14. But I think this is because of when the whole advertising thing became very predominant. Middle school kids have really grown up seeing all these ads, and they are a lot more familiar, I think, with this product. And we also asked about how many days in the past 30 days have you used e-cigarettes. And you'll see here, it's not 30 days, but it's not small either. And the next slide kind of drives home this point even more. This is days of using e-cigarettes in the past 30 days broken up by whether you are a never smoker, so which means you've never tried a cigarette, whether you're an ever smoker, which is you've tried a cigarette in the past and are not using cigarettes right now, or a current smoker, as expected. The current smokers are the ones who say they use the maximum number of days, but it's not a small number. It's not just trying it once. They seem to be trying it on multiple days. But this is just the tip of the iceberg. I mean, we need to learn so much more about this. So the thing I always raise about the first slide I showed you is, are these kids who just try once and then never try again? Is it just something they do because they're curious? I mean, that would be great if that's the case, that they don't continue use, and I sincerely hope that's what the data shows. But if it's not, then it's concerning. The other question we asked in our survey is, do adolescents who have never used e-cigarettes intend to try e-cigarettes in the future? So there are some susceptibility or intentions to use scales created by a number of different people, but one of them that's been a really good predictor of future cigarette use behaviors is one created by Pierce. And it has a couple of questions, but they are around things like, do you plan to use e-cigarettes in the future? It was for cigarettes, but we adapted it for e-cigarettes. Would you use an e-cigarette if your best friend offered you one? Because peer influences are a huge issue for kids. And based on that, we developed an intentions to use question, a score rather. And we find that amongst middle school, which is the light purple, and high school dark purple, in the whole sample, there are a significant percentage of kids who say, yes, I intend to use e-cigarettes in the future, in the sense that I intend to either try it, or if somebody gave me one, I would try it. But again, does this translate to chronic use behaviors? We don't know that yet, and that's what our longitudinal data will hopefully tell us.
Do you know how that compares to cigarettes?
I'll show you in the next slide. This is right here. So we actually looked at intentions to use cigarettes versus intentions to use e-cigarettes, and e-cigarettes is actually trumping cigarettes right now. So the kids are more likely to say, I've never used either of these products before, but I would be more likely to try an e-cigarette than a cigarette. Okay, then the next question we asked is, are adolescents reporting that they are starting tobacco use with e-cigarettes? Now, I tell you, this is the million-dollar question that everybody is interested in. But I think this is best answered using longitudinal data, and that's why I'm so eager to get my hands on my Wave 3 data to see what it's actually saying. So to take the findings, I'm going to show you with a pinch of salt. So this is our data from our first survey where we asked, and this is a very small sample, again in middle school, but we asked the kids, what is the first tobacco product you tried? And 50% of the small sample of middle school kids said that they started with e-cigarettes. And you're also seeing, kind of similar responses to all the other tobacco products. But for high schoolers, it's mostly cigarettes that they tend to start with. Now, again, remember, this is retrospective, there's a huge recall bias here, so that's why the longitudinal data is needed to say this. Another way we looked at the data is we said, we looked at what was the first tobacco product tried amongst cigarette smokers. So we asked kids who reported that they had tried a cigarette in the past, what was the first tobacco product you used. And then we also asked the kids who said they had smoked greater than 100 cigarettes in their lifetime, what was the first tobacco product that you used. And interestingly, 40% of both these samples said that they started with e-cigarettes. Again, retrospective.
Do you know of if they had e-cigarettes as the first tobacco product they tried, what percentage of those were flavored?
Do I have the data? I have not looked at it that way. I'm going to show you some flavor data, but I don't think I have looked at. No, actually, I do have that data, but I don't have that slide. We did look at almost everybody used a flavored product. Yeah, I'm sorry, I'm just thinking. I'm a little caffeine deprived.
And the idea about susceptibility, have you been able to look, like the 40% of the youth that are saying they started with e-cigarettes, does their susceptibility line up that they would have maybe likely started with, like, if there were no e-cigarettes, were those the youth that might also have tried cigarettes?
That's an excellent question, and we haven't looked at it that way, and we should, because we have the data. So that's a very, very important point, and good idea.
Yeah, and the inverse of this statistic, so of the people who started with e-cigarettes, do you know what percentage of them switched to, or I'm sorry, of the people who started with cigarettes, what percent of them went to e-cigarettes?
Went to e-cigarettes? No, we have not looked at it that way. For this talk, I was focusing mainly on that angle, but we can look at that also. We haven't looked at that. But really, I'm a little nervous about doing too much analysis and publishing too much with this kind of data, especially since we have the longitudinal data coming. So I've not focused on this because I really feel the longitudinal data will answer a lot more questions than this data can. But we do have that data, and we could look at that, but we will. Okay, so moving on, in our more recent surveys, we are asking more information about what kind of products the kids are using, with the idea that are there particular products that are preferred? For the most part, in 2013, we found that almost everybody liked the rechargeable products. So nobody liked the disposable blue e-cigarette, which is what I was describing for you earlier, because it was like a cigarette. They were looking more for things that looked like their iPhones, which they can plug in and they can play around with. That's really what interested the kids in this. So rechargeable products were very, very popular. These are some of the brands of e-cigarettes, and I just told you I was going to disagree with myself. These are some of the brands of e-cigarettes reported by about 500 e-cigarette users in terms of what brands they used in the past month. And you see here that there's Blue, Encore. Now the Blue tank system was just starting to come out. So when we did this, so it's possible it was a tank system, but I'm not really sure. But these were some of the products that were preferred. And the strange thing about this market is you get all this information and then you turn around and the products are gone. So for example, like the Smokio device was enormously popular in this, with some kids, but now it's off the market. It's completely gone. So, this is the hard part about this market. You can't keep up with it. It's growing so fast and it's changing so rapidly.
Can I ask you a question about the preferences?
Yeah.
Those are the slide before that.
Oh, of course.
So this is, it's use, not preference. So the rechargeable products are much more expensive.
They were much more expensive. I have a very similar slide for preference also, which I'm not showing you, but it looks almost exactly the same. The rechargeable products are more expensive. However, here's what we discovered. Kids are sharing them. So they are not buying it for themselves alone, or they are not even buying it in some cases. Somebody is buying it for them. And this is where I think a lot of our education efforts need to go to, because I've spoken to many parents who say, oh, my child said they wanted to smoke a cigarette, and I told them, well, why don't you, I didn't want to come down and say, no, you can't do that because they might go ahead and use it. So I told them, okay, why don't you try an e-cigarette instead? And, I don't know that we're ready to give that message yet to kids. And this is a concern because there's lack of public knowledge around this issue. Yes?
Where are they smoking?
I have a slide I'll show you on that in a second.
Related to that, what's the smell? Like, if you did an e-cigarette and
You'll smell the flavor, but nothing else.
so as an adolescent, you can smoke cigarettes.
You
in your
could.
house, it won't hurt your throat, and your parents won't find out.
You got it. Yeah. And unfortunately, that is true. Yeah. That is a concern. So that's why I think we need to educate parents in a big way. And for a couple of other reasons I'm going to show you as well. So
Is there any evidence that youth are using their parents' devices?
we are asking that question right now. We don't know that answer yet. A lot of parents are using the devices also. I don't know.
Because you could, like, if you take a cigarette out, a parent might notice. But
Yeah.
Just take a drag on the.
Yeah. It's an excellent point. Yeah. So I went through that. Okay, this is where we asked about tanks, like what sizes of tanks that you've used for those of you who are interested in these kinds of logistics. There's a wide variation there. Another question we are interested in answering is, are adolescents using e-cigarettes with nicotine? So this is, did you use nicotine in your e-cigarettes? And I would like to also point out to you, there's quite a bit of I don't knows to this question, because they take it from their friends, they're sharing products, they don't know what's in them, and they're just vaping them. So, I keep telling myself I'm not going to use the word vape, but I keep going back to it. But they're just using them, just like they use cigarettes. They don't know what's in them. But a lot of people are telling you that they are using it with nicotine. And this is in our 2014 survey. That was 2013. In 2014, we got a little more creative about asking about this. So we actually put nicotine concentrations and put 0 milligram in there to actually get them to think about it, what kind of concentration of nicotine have I used. And you can see here that a lot of the non-smokers, 50% almost, are saying that they use it without nicotine. So they are using 0 milligrams of nicotine, which is good from a nicotine addiction perspective, but is concerning from the perspective of what are they using this for then, and what they're being exposed to all the other constituents in it. Is that having a harmful effect on them? I'll show you some data from our focus groups and our qualitative work on why kids use e-cigarettes. These are some of the reasons that kids say they use e-cigarettes. The top ones are good flavors. Curiosity was a big one, and I don't know what to make of that, which is a very interesting issue. If they are just curious about it and you try it once and you don't continue, that is wonderful. But some of the top ones here were good flavors, perception that it's healthier than cigarettes, my friends use it and can use it anywhere. And the 2 bars are, the middle school is the lighter bar and the high school is the darker bar. Flavors are a huge reason why kids use e-cigarettes. As I said earlier, there are over 7,000 flavors. You get to not only get banana cream pie and Captain Crunch, but you can put banana cream pie and Captain Crunch together if you want and create your own blend, which is, which we hear about a lot of the kids doing. I don't know what they taste like or smell like, but they do it all the time. These are some of the top flavors. We were kind of rudimentary in our assessment of flavors in our 2014 survey, and we only had these categories. Now we've split up our categories even more, because now we've realized there are 7,000 different flavors. So we even have things like umami now, which is really kids. I'm not umami the word, but that reflect umami. Because you can get a Thanksgiving flavor, by the way, which says that it'll combine turkey, cranberry, and potato all into one. So, yes.
Sorry, aside the flavor, what else does it contain? Is it just flavored, like inhaling or something?
No, the original slide I showed you the constituents. It contains formaldehyde, propylene glycol and vegetable glycerin, and it contains a variety of other chemicals, but it varies widely in terms of what else they contain. And then the flavors by themselves have chemicals in them, which is also a concern. So some of the chemicals, like cinnamaldehyde, which is in flavors, has been shown by some research conducted in our T course to actually be toxic, lead to cell death. Some of the levels of cinnamaldehyde found. There was a flavor called atomic sinicide, which was taken off the market after some of the findings came out. But some findings from our group and some cell culture findings from the North Carolina group showed very clearly that it was leading, that even a small dose of this led to cell death. So they took atomic sinicide off the market. But we don't have that kind of information on all the flavors. Yeah.
Have you, in addition to flavorings, have you come
Yes. Yes, we have, and we just collected, we put on all that information in the most recent survey, so we have collected this. I don't have data to show you, but we do have people who are stating that they're putting all kinds of things. In fact, I'll show you one data in a second. This was just where we asked kids, would you try an e-cigarette if it only came in tobacco flavor? And a lot of them said, probably not. It's just an indication, if you would, that the presence of flavors may really be affecting their decision to use these products. So getting back to your question, what else are kids using e-cigarettes for? I'd like to spend a few minutes on this because I think this is going to be a very important part of the whole trend. Smoke tricks, for those of you who don't know, smoke tricks are very popular with e-cigarettes. Because of the glycerine in it, you can actually produce smoke vapor. So it's like I keep saying this over and over again, it's like their form of bubble gum. They can do all kinds of neat tricks with the vapor that's created. My son has a friend who knows somebody who he says, friend of a friend of a friend, I don't know how true that is, who is a professional vapor. So he goes to vaping contests, and he practiced for vaping contests. So they practice how to make these tricks. It's like the guy in your coffee shop who makes the little things on the foam. You have to practice on this, I guess. So smoke tricks are very popular with e-cigarettes. The other thing that we've just had a paper published on is using e-cigarettes for vaporizing cannabis, marijuana. It's a natural extension, I think, of the presence of the device. Vaporizing cannabis using portable vaporizers is nothing new. It's been around for a very long time. But I think the use of these products for this purpose was restricted to the states that had more lax laws about marijuana use. I think the presence of these products on a more broad basis has led to more use of e-cigarettes for vaporizing cannabis. And some of the things they say they put in it is hash oil, THC wax, and probably a variety of other things. But you can see here that amongst the kids who say they use e-cigarettes, there is quite a lot of kids who say that they also use it for vaporizing cannabis. Mm-hmm. It doesn't smell like cannabis, if that's what you're going to ask me.
No. There are two different things, nicotine or whatever these great chemicals
Mm-hmm.
they're called, and cannabis.
Mm-hmm.
Do they need to be heated to different degrees, or do they just work cross products?
So we don't know. We actually don't know if they are using nicotine with the cannabis, whether they are using cannabis alone. Those are the kind of questions we didn't ask that we are trying to get at.
Is vaporizing temperature for both things?
Because it would be in solution, it would.
I don't know.
Boil point of the solution versus the.
I don't know. The solution is the same. I would assume that it's all vaporized because the solution is vaporized, but I don't know the answer to your question. I think we need.
So you can control the
Yeah.
heat and the power, so you have control over how.
But we still don't know what level of it gets vaporized. That's the question you're trying to get at. We don't know, like when you vaporize using one temperature versus the other or one voltage versus the other, how much of cannabis are you getting? And we need those kinds of studies. Okay, now where do adolescents use e-cigarettes? Somebody had a question about this. We asked them, where do you use e-cigarettes? And they said, most of them say they use it at home. Because you can use it in your room and nobody will be the wiser of you being able to use it. Or maybe they use it with their parents. A lot of them are starting to say the parents use it too. School, public places where smoking is not allowed, and a variety of other places that you can see here. So this really speaks to the idea of instituting and really monitoring e-cigarette bans, especially in public places. And this is where I was talking about the parental education piece becomes very important. I think we really need to let parents know that we just don't know if they are harmless yet. So the encouragement for kids to use these should not be something that should come from them. If they are a cigarette smoker, really they should tell them to quit, and that should be the message that we deliver to everybody. We asked them where they get their, I don't have much time, so I'm going to flip through these slides quickly. Where do you get your e-cigarette from? And most of them got it from their friend, girlfriend, or boyfriend. Some from tobacco shops and a variety of other sources. Most kids have never tried to buy an e-cigarette. So obviously they get it from somebody else. 50% almost say, I've never tried to buy an e-cigarette. But there are kids who have tried to buy it from online stores and from physical stores or from both locations. And the sad part is that only a few have been refused sale. especially from physical stores, only 23% of the kids, this is about 400 kids, who said we tried to buy it from a physical store but refused sale from the physical store. And from an online store, the number was even smaller. So, these are very easily accessible, can be easily purchased. Now, the big million-dollar question is, are they using it to quit smoking? And I'll show you some very preliminary data. And again, keep this in mind. This is not, sufficient evidence. We need more. When you ask kids, are you using e-cigarettes to quit smoking? About 20% of them say, yes, we are using e-cigarettes to quit smoking. Of course, that doesn't mean that it worked, but they are saying we are using e-cigarettes to quit smoking. And this breaks it up by past month e-cigarette frequency. So you can see that those who are daily smokers or more frequent cigarette smokers tend to be more likely to use e-cigarettes to quit smoking. So at least this is one positive sign that maybe this is headed in the right direction. But we need more data than this to support that. So, to basically summarize, use rates are really increasing exponentially. I think I've talked to you about how there's very high rates of future intention to use, even, especially amongst non-users. And there's a whole wide variety of use that's going on. The other thing that I forgot to mention is dripping. This is a new thing that kids are doing nowadays, which is you take the e-cigarette apart and you expose the coil, and you put the solution directly on the coil, and you take a whiff. The smoke that's produced is a lot denser, and it gives you that throat hit. So a lot of smokers who are amongst the youth say they are using e-cigarettes in this way for the throat hit. But fortunately, here's one thing we've noticed with dripping is we saw dripping, a lot of dripping last year. I'll be curious to see this year's data to see if dripping continues, because a lot of the youth are telling us that dripping is just not worth their time, because it involves taking the device apart and finding the solution and dripping it on, and it's not something you can do in your car, so they don't really like it that much anymore. So I hope that is the case.
So is it burning more?
Yes, it would be higher temperature. So that's the concern. So if you're burning something, so the formaldehyde and acrolein that I pointed out earlier are formed at higher temperatures. So if you're dripping it directly onto the coil, you're producing higher temperatures, so you may get more exposure to those products. So, but again, a behavior we need to keep an eye on. So the implications, I think, of this are we really need to regulate the product to reduce appeal to adolescents. I really feel the issue of flavors has to be addressed, and we have experimental studies going on where we are trying to see if flavors affect abuse liability of the products. So, we will have more data on that in the future. I think the local and federal policies to prevent access to minors and restrict use in indoor locations and schools are really important. And I very strongly feel we need educational and prevention programs to really inform the public accurately about what e-cigarettes are and let them make an informed decision, but at least give them the right evidence. And this is some of the things that I thought needed to be done, and this is my whole group. I could never have gotten any of this work done without everybody in this group and all the research assistants and everybody who helps us with the collection of the data, which is an enormous process. And I will stop there. So. Oh, good. Look, I ended with one minute left, which is good. Any other questions? Yes?
All the questions that you guys are asking the youth are wonderful. And I'm wondering, does the youth behavior risk survey, do they have any e-cigarette questions built in?
Yes. So all the national surveys now have e-cigarette questions built in. They vary widely in terms of when they started asking about e-cigarette use. So I don't have, somebody has done a detailed analysis of this. I'm sorry, I don't have it in my hand right now. But some surveys actually started asking about e-cigarettes quite a while ago, and others have added on other questions. But here's the caveat. National surveys are a little restricted in terms of what they can ask and how much space they have. So they don't have as in-depth questions as we do in some of in our surveys, asking more about the behaviors and kind of going into that. And that's understandable. They have restrictions in terms of how much they can put in. But almost every national survey has e-cigarette questions now.
You mentioned that there was a lot of discussion about the adequacy of current e-cigarette use measures. What are your thoughts on kind of how we should be measuring?
So this is we have a whole work group devoted to this, which is actually through the T-Course, which should come out with a kind of guidance paper very soon. And then we are doing some work around taking the items and doing cognitive testing and then actually measuring them. So we may, extend this out to a larger group. So if any of you are collecting data and either have data that you'd be interested in sharing to this with this work group or doing more work on it, let me know, because there's a great deal of interest in collecting the information. They're going along certain areas, obviously the use, like past 30-day, ever use, which is the regular things. Then there are other ways, innovative ways that we're trying to approach the whole use issue, measuring things like how long does it take you to finish your tank? How many puffs do you take every time you smoke? How many episodes of puffing do you have per day? Things like that. We are trying to get at these issues, but nothing's none of it is things that you would not think about. So just kind of, I would say, try to understand the behavior, and then I cannot share the questions with you right now because it's being created and they haven't been validated, but I'm happy to when we have it. Yeah.
So I worked on a paper in Colorado with some people, and we looked at marijuana use of alternative ways to use marijuana. And there's a question on perceived harm, and it's like, how bad do you think it is to use marijuana? And among marijuana smokers, those who had higher levels of perceived harm were more likely to vaporize. So my takeaway is that we have gotten the message across that combusted products, even like the cigarette, what we talk about
Absolutely.
cigarettes applies to marijuana.
Yeah.
And so they're thinking that vaporizing marijuana or eating marijuana is safer. And so I guess I wonder now, we need to get better at the perceived harm question. So like, what do we know about perceived harm of using e-cigarettes?
Correct.
What do we know about perceptions of perceived harm for, we know people think smoking cigarettes is terrible.
Right.
But our questions haven't caught up with the reality.
And absolutely, you're absolutely right. And our questions are also not keeping up with the way the field is changing, because the e-cigarettes are getting better and better and changing all the time. So people's perceptions of what the product is today may not be the same perceptions as what it is a year from today, because the product may look completely different. So you're absolutely right. I think the question of perceived harm is a very good one, and yes, your data will indicate that they considered non-combustible ones to be less harm. But I think as a society, we have to decide what do we consider and accept as less harm. That is the question that I think this is raising, which is where do we draw the line of risk versus benefit? And what amount of risk are we willing to accept for a benefit, and what is that benefit going to be, and all those kinds of questions. So I personally think this e-cigarette debate is a fascinating one. It's never without enthusiasm, for lack of a better word. But I think it's a good thing we are having this debate, and it's a good thing we are collecting this data. Yeah. Thank you. Pull it all out.
Yeah, and I'll just say, it's very interesting. I spoke to some young teenagers as well, and Dr. Krishnan-Sarin mentioned, or I'm trying not to say vape. It's very interesting because I think it leads to perceived harm, or there's a relationship. Because I was talking to some teenagers who are saying, "Oh, it's vaping. It's a vaping product. It has nothing to do with cigarettes. Of course, it's like not harmful because a whole other name." And we were talking about how that's industry terminology, trying to separate it from cigarettes. So I think there's a lot of work to do there.
There
It's
is.
very
I
interesting.
keep saying vape too, but I'm trying to tell myself not to use that term because we are trying to understand use of this product, and we don't want to use the terms that the industry is using, because then it gets difficult for users to respond and understand to some of the questions we are.
So I think Dr. Krishnan-Sarin has a few minutes afterwards, so if you have any more questions, she'll be here for a couple minutes. And I'll just say that at the Institute for Global Tobacco Control, we've been working on a global scan of policies around electronic cigarettes, and it's going to be live and interactive on our website next week. So if anyone's interested in that, including policies around sales to minors of e-cigarettes. That's all available. So thank you all. Thank you, Dr. Krishnan-Sarin, for sharing the data with us.
Thank you.